Welcome everyone to today's speaker series. Thank you all for joining. My name is Rosa Staltieri and I'm the Knowledge Translation Manager with CanCOVID and the speaker series host and moderator. It is with great pleasure to welcome Dr. Catherine Haeck, who will be discussing the impact of school closures on parental work, especially with single parents, and the evidence on inequalities in youth test scores and the potential impact on these scores with schools closures. Dr. Catherine Haeck is associate professor at the University of Quebec in Montreal, and also in the Department of Economics. So before we get started, there's a few items that I'd like to note. We ask you that you ensure that your microphones are on mute during the presentation, but we welcome you to unmute yourself during the question and answer period if you'd like to ask your question live, and please do so by raising your hand. You can also ask your question or make a comment or remark during or after the presentation in our chat box. And we also like to note that our sessions are recorded and published on YouTube in about 2 to 3 business days. So without further ado, I will hand over the floor to Dr. Haeck.
Thank you so much. I hope I'm not muted right now. Sometimes it happens. So thank you so much for having me here today. I'm really happy to come and talk about this quite important topic that we have, especially in the wake of the recent closures in Ontario. So my talk will cover some of our works on both parental work and youth development. And I'm trying to do like a short review of some of 3 papers that we have written on the topic. So, oops. Okay. So one thing that we know for sure about school closures is that they do have multiple impacts on children and their family. And one thing for sure is that they create learning interruptions. We're not sure yet how big these interruptions will impact their development, but we know they create interruptions and we have to document those interruptions. We also know that school closure create work disruptions for parents, but we, up until we did this work, we didn't know to what extent they created work disruptions and who was most impacted by school closures. And here I'm talking mainly about primary school closures. So in this talk, I will cover both topics. I will start with parents, the impact on parents of school closures, and I will also discuss the likely impact on children. I'm saying the likely impact because in Canada, we don't have good data across the country post-COVID-19, so we're not able yet to measure the impact it actually had on children's development. Okay. So let's talk first about parental work and the likely impact on income inequalities. So in this paper, what we do is we estimate the impact of school closures on parental work. And to do this, we exploit a triple difference approach. So really what we're doing is we're using the confidential microdata from the Labor Force Survey of Statistics Canada, and we're comparing the labor force participation of parents of primary school children with that of parents of high school children before and after the pandemic. So this really allows us to capture the impact of what you will see is school closure while controlling for other confinement measures or the release of certain measures at the same time. We have a total of 35, sorry, this is my daughter. We have a total of 355,000 parents in our data set. So we have quite an extensive data set and we're pretty confident that we capture well the impact on parents. So this gives you an overview of how school closure happened in the country during the pandemic. So if you look about at March and April, school and primary school were closed across the country. So there's really no variation here that we can exploit. They were all closed more or less at the same time. If we think about the labor force survey data, the labor force survey data is run every third week of the month. So we need to look at school closure in the third week of the month. So there are exact dates available on the website of Statistics Canada. So we did check that. So our reference here is the third week of the month. And what we see is that there were only a few points of variation across the country. So one variation happens in May, where in the rest of Quebec, excluding the greater Montreal area, schools were reopened. So we are able to capture the impact of school reopening using this variation in the country. And then when we look at the fall, all schools were open across the country in September, October, November, and December. And then in January, as you probably remember, since it's not as far in your mind, schools were open across the country, except in Southern Ontario, where they were closed. So this is the variation that we will be exploiting to estimate the impact of school closure, or in this case, the flip side of school closure, school reopening on the labor force participation of parents. So this first graph shows you mainly the mother. Here I focus on mothers, but you will see I will present the overall result on both fathers and mothers. On the left side, you have mothers in dual parent household, and on the right side, you have mothers in single parent household. What we have here as an outcome is employment at work rate. So there's really a few measures that we can have here in the labor force survey. So there's the fact that you are employed and working, the fact that you are employed but absent from work, and there's also the number of hours that you have actually worked. So not your usual number of hours, but the number of hours you have actually worked. So if you look at this first graph here on the left, you see the evolution of the labor force participation of parents for 3 regions in Canada. First, you have the diamonds are for Quebec outside of Montreal, because as you may recall from my previous slides, the schools reopened earlier in that region. Then you have the square. Those are for Southern Ontario, since Southern Ontario kept its school closed in January. And then you have the rest of Canada in the circles. When the circle is, when the shape is open, hollow, this means that the schools are open. When the shape is full, this means that schools, primary schools are closed. So what you can observe here, of course, you have the normal evolution that we had prior to the pandemic. These are seasonally adjusted, by the way. Here you have the summer months, so that's why you don't see the big dip, because it's seasonally adjusted. And then if you keep going, I hope you see my arrow here, you see the fall in the labor force participation of parents due to the pandemic. And what you see here that's quite interesting is that when school reopened in Quebec, you see a jump of the labor force participation of mother in dual parent household. And you also observe in a similar way a jump in the labor force participation of mothers in single parent household. Obviously, these are just descriptive statistics. When we run our triple difference in difference model, we are able to estimate the following impact. So I invite you to read our paper if you'd like more details about the technical part of it, but for this talk, I kept it more general. So what we find is that reopening school in the spring outside of Montreal and Quebec increased the labor force participation of parents in dual parent households. So the employment rate rose by 9 to 10 percentage points for both fathers and mothers. And the number of hours worked per week increased by 2 to 3 hours for both fathers and mothers. But the largest impact that we found was really for single mothers. There we found that single mothers' employment rate rose by 22 percentage points. This is really large. And this means that closing down schools, the flip side of reopening, has a major impact on single mothers. And their ability to work also increased. So they were able to work 8 hours a week more once schools were reopened. When we look at what happened in January in Ontario, this was more like a temporary closure. This was not the result of a long-term closure and with reopening. This was a temporary event and parents were aware of that. And what we see there is that closure in Southern Ontario did not really impact parents in dual parent household, but had a major impact on single mothers. So in areas of the country where we kept school open, single mothers were more able to work, and they were able to work more hours. So their labor force participation, their employment rate was up by almost 17 percentage point, and their number of hours worked per week was up by 7 hours per week. So closing down schools. So this paper in a nutshell shows that when we close schools, of course, there is an impact on parents, and this impact is much larger for single mothers. And these families are already vulnerable to start with. So this creates inequality in our country. Now, if I look at the impact on children. So this is a bit, oops, I'm trying to skip. This is a bit harder to get at. So what we did when the pandemic started, we first looked at what was happening. So just in the spring, we closed down school in most part of the country for about 3 months on average. There was virtual schooling across the country, but it was limited and it was unequal. In some areas it was better, in others it was not as good. Access to internet was also different depending on your family situation. So really created a situation in which some kids probably were able to keep up while others were not. So, and in the fall, while we reopened all the schools, there were some interruption due to the virus hitting some class and not others. So the really big question that we have going forward is to try to understand what these school closures will do to our children and what the impact will be. So for now, we don't have a lot of data on this, but I would first like to tell you a bit more about what we know, what the literature already back in the spring, what we did is we read a lot to try to understand what this could mean for our children. So there are a number of strategies you can use to estimate or anticipate the impact that school interruption can have on children. So these strategies include summer learning losses, teacher strikes in the past. Regulations in school entry age can also be exploited to see when you have one more year of schooling or less, what happens in terms of cognitive development. Previous pandemics have also been exploited. So Mayers and Thomason look at the polio pandemics in the early 1900s. And then there are also, since we published our paper in the summer, there have been research done in Belgium and also in Denmark. So DeWitt is in Belgium and Engzel and colleagues is in Denmark, where they really look at the impact of the pandemic on children. So what happened in those countries is that they had run just prior to the pandemic standardized tests in their schools. They closed down schools in Belgium and Denmark for about 8 weeks in both countries and reopened before the summer months. And they ran the typical standardized test that they would normally do every year. And what they realized is that indeed there was a reduction in learning, and that the reduction was steepest among children, vulnerable children. So what we know from this literature in a nutshell, without going in all of the details, and some of this literature is Canadian specific, so I'm talking about Baker in 2013 and Johnson in 2011, for example, but others also. We know that when you estimate the average effect of school interruption, you can get a 0 or a small negative, and this masks important differences by socioeconomic status or by the ability of the children. So what happens if you think about just summer learning losses literature, what you see there is that children in more well-off family get better over the summer, while children in less well-off family decrease their ability. So when you estimate the average impact of summer learning losses, the impact is on average 0. So you have to estimate this by socioeconomic status, by prior performance, to really understand what's happening. And what we also know is that these effects persist in the long run. So there's a really nice study in the Journal of Labor Economics by Jome and Willen here. And this shows the long-term impact of a major strike on teacher strike that lasted for over 190 days. And it looks at the impact it had on later outcomes, such as the labor force participation of the children that were impacted by teacher strike, their income, and even the intergenerational transmission of these effects. So even the children of those that were impacted by teacher strike struggled more in school. So these are not trivial. So now, if we think about Canada, we think about potential impact of school closure in children and youth in Canada. And why we say potential impact, can you please give me a minute? I'm really sorry. My daughter is really sorry. I really apologize. Um, I will just mute this for a second. Sorry.
No worries. Take your time.
I'm really sorry. It's just
No,
she came back from school and nobody's taking care of her. I just don't see the mute button. Sorry.
oh, no worries. There you go. You're muted already. So everyone that's just waiting, you have an opportunity now to ask your question in the chat box, and we can relay the question during our 10-minute question and answer period. Oh, perfect. Thank you so much, Catherine. Ready whenever you are. One second, Catherine. We're just going to unmute you. There you go.
Okay, I'm really sorry about this. I was talking about parents' labor for participation, so this is quite fitting, in fact. So, so I was saying potential impact in Canada. Why do I say potential impact? It's because we don't have data on children and youth. And this is something I've been talking for over 5 years. And I even remember 5 years ago saying, oh, what if something really bad happened? We don't have data to measure the impact on children. And I didn't think I was actually forecasting something that would actually happen. But Canada invests large amount of money in all sorts of surveys, collecting data on labor force participation, health among adults, and all sorts of things. But when it comes to the development of children and their well-being and their families' well-being, we are really poor as a country. We used to have a really nice survey that was called the National Longitudinal Survey of Children and Youth, known as the NLSCY. But this survey has been discontinued in 2008. And since then, nothing has replaced the NLSCY. So as a country, we need to ask what are our priority, and we need to invest in this, and we need to do this quickly, because we need to know who has suffered from the pandemic, where they are, what we need to do, and measure the impact of the intervention we will put in place. So because we didn't have any data on actual the impact on children, what we did is we went back to try to understand first where Canada sits in terms of inequalities in the country. So we used PISA data. So what we did is we collected all of the PISA data in the spring to try to understand what kind of inequality we are facing, and should we be worried about those at the bottom? Are they really, really struggling or not? So, and what we show here is the performance gap between the children who are quite successful and children who have more difficulties. And what you see here, if you look at the little dot, the red dots at the top, these are the children who have more facility. And this is a mathematics score, but if I were to show reading or science, it would be exactly the same picture. So you see those children at the top here doing really, really well, and in every single province. Now, if you look at the development of children at the bottom, those at the bottom of the distribution, they're struggling. Their score is lower, and it's lower than 482 points. And what does that mean for PISA? When you're below that threshold, you don't have the ability to pursue post-secondary education. You don't have what you need to pursue beyond high school degree. So this means that all of these children don't have the capabilities to succeed later on in the higher education system. And this was prior to the pandemic. So this is the portrait we had prior to the pandemic. So these are the kids that we are worried about. And it's the same picture across all provinces. There's no single provinces that stand out. We all face the same problem. Now, if we look at the same, and just to give you an idea for PISA, people who are not familiar with PISA, when you have a 40-point gap, 40 point in PISA represents about 1 year of education. So if you look at the difference between the red dot and the yellow dot, you're talking about over 200 points difference. So there's really a large gap in knowledge between these children. Now, if we look by socioeconomic status, we also have a similar portrait. So in terms of socioeconomic status, PISA has several measures. Here we focus on the measure that is built upon the occupation of the parents. Kids are asked other information, but the problem with that is that they're not really good at reporting their parents' education, but they're really good at reporting their occupation. So it's actually the best measure to use. So what we do is we classify parents in 5 groups. The Q1 is the parents with the lowest level of the socioeconomic status, and Q5 is the highest level of socioeconomic status. And then we compare the score of their children, one versus the other. And then what you see in the next slide, and again, a similar portrait, one for each province. What you see here, the orange circles are the score of the children of parents with a high socioeconomic status, while the red circle are the score of children with parents with a low socioeconomic status. And the triangle, the blue triangle here, measured the difference between the red circle and the orange circle. And again, what you see is, if you look in terms of socioeconomic status, children coming from lower socioeconomic status are typically below the 482 lines. So they are struggling. They don't have the capabilities to pursue higher education. So we have inequality in this country, and it's likely that the pandemic will have increased this inequality. And there's nothing special about any province here. We all have the same problem. Our inequality is comparable to that of Finland and Sweden. So we are actually one of the leading countries. We have a level of inequality that's smaller than what you would observe in most countries, but we still have inequality, and we still have children who are struggling, and those will be impacted by the pandemic. So what we did, since we didn't have data on what was happening, we did a projection. So we used data from other people, studies from other people, to try to get a sense of what could happen. And our view is that the interruption of 3.2 months in the spring likely increased the gap between the kids from the low socioeconomic status versus the high socioeconomic status by about 30%. So what we expect is that kids from the low socioeconomic status will have lost about 2 months of learning during the pandemic, and kids from the high socioeconomic status will not have lose anything. They will have been able to catch up in some other ways through the online learning, through their parents, through other means that were available to them. And just to wrap up in terms of what we can expect, there's a really nice work that has been done by Haeck that project that school closure alone. So I'm not talking about any other impact of the pandemic. I'm just really talking about school closure in the spring will generate a loss of about $1,000 to $2,500 billion US for Canada alone. So this would represent about 1 year of GDP over 80 years. So this is massive. So these are losses in productivity, losses in learning, ability to reach a complete high school degree and pursue in higher education. So hopefully, maybe by next year, we will have actual data about Canada, but right now we could only do a projection. So just to conclude, what we have done so far using data that was available, we have looked at school closures. We have shown that it has an impact on parents' ability to work, including myself, clearly, and a larger impact on single mothers. So this creates inequality between parents in terms of income and in terms of ability to maintain a relationship with the employer. Then it also has an impact on children and youth. It impacts their learning, it decreases learning, and especially for youth coming from lower socioeconomic background. So again, increasing inequalities. And there's a tight link between single mothers and the socioeconomic status of children. So you're really creating inequality on 2 fronts for those families. So when we think about closing schools, and there are good reasons to close schools, and I'm not arguing that we should never close schools, but people who are making those decisions, with epidemiologists who know way more about the virus than I do, need to factor this into account. So it really needs to be a last resort intervention when there's nothing else we can do to stop the spread of the virus. And finally, I'd like to conclude on one message, is that we need better data on children and youth in Canada. We need a commitment by researchers to get data on children and youth, and high quality data managed by Statistics Canada. So I will conclude here. Thank you for your time, and I do apologize again for my daughter's interruption. Thank you.
No need to apologize at all. That was an amazing presentation. Thank you so much. Really insightful. And we have some questions in the chat box already. So we're
Okay.
5 minutes for that. So I'll relay the first one. Although we are talking about the impact on learning and the widening inequalities, if you could speculate, what do you think are the impacts on child health and single parent health and health inequities?
I'm not as familiar with health outcomes than other people would be. I'm an economist at first, and I could expect maybe there would be some trigger on health later down the road, because we know there's a link between education and health. So I would expect that if really we are not able to resorb the impact this pandemic will have had on learning abilities and then on educational attainment, this will trigger an impact also on the health of these individuals. Concerning the impact on health right now, I would think that the biggest impact is probably more on mental health than physical health, although I'm guessing mental health triggers physical health also, but I'm not an expert on health, so I would stop there.
Thank you. And we have another one here. Is there a way to determine what unique impacts there may be on children with disabilities and or learning differences, for example, dyslexia?
I would expect that these children will have suffered more than others. It's for sure their education, their learning has been interrupted for a very long period of time, and for them, it's important to keep up, to have a regular schedule, to have the people that they need around them to provide the services that they need, and all of this was completely stopped. At least in Quebec, I don't know about other provinces, maybe they were better able to manage this, but for about 3.2 months, these kids didn't receive the services they were supposed to. Although we did reopen schools for children in need faster than others.
Thank you. I don't see any hands up at the moment, so I'm going to continue with the questions in the chat box.
Perfect.
The next one is saying, wonderful presentation. I'm curious how much variation around the working hours of parents. The LFS gives an approximation of hours worked per week, but can you speculate how accurate this reporting is? Yeah, that's the question.
Yes. So the labor force survey is a survey that has run for like a very long time. So it's a very well run machine, if you want. And in the way it's designed in the LFS, it's a rotating panel of 6 months. So everybody that enters the LFS stays for 6 months. So the questions are repeated over and over the period of 6 months. And there's 2 questions that are asked. Well, there's actually more than 2 questions, but there's a lot of questions that are asked, but there's really 2 measures that you can look at. And then there's one that measures like usual hours of work. And those are typically asked at the very beginning when they first enter the labor force survey. And then what happens is that every time the person answers the questionnaire, every 3rd week of each month during the 6-month period, the people are asked to estimate their actual hours of work during that week. So for me as a person and as a researcher, I think it's it's very reasonable to assume that people are well able to estimate their hours of work in the week that they have work now. So when we ask questions about the past, often it's a bit tricky and we have weird answers. But if we ask people about how many hours they've worked in the last week, I can estimate it easily. So I always think about myself, can I answer this realistically? And so this is a question I'm really comfortable with, and I'm pretty confident it was well estimated, well reported, if you want. And the value added of hours versus other questions that were asked in the LFS regarding employment is that because of what happened in the pandemic in the spring, it was confusing for people what was their employment relationship, because some people were furloughed but knew that they would go back to work, so they were not really looking for another job, but they didn't have a job. So the typical measure that we use in economics, that would be unemployment, which would be measured by people not employed and looking for a job, we could no longer use, because people didn't have a job, were not looking for a job, but they knew they were going back to their previous employers. So hours were actually most used during the spring, even more than other types of measure we typically use in economics.
Thank you. And we have time for just one more question.
Yeah.
So are you aware of any choices to allocate educational resources from advantage to disadvantaged children post-pandemic, even vague proposal?
If I'm aware of actual proposal at a certain, in one province versus another, for example?
I believe so, yeah.
Okay.
Yeah.
Well, I cannot speak for all of the provinces. I'm very close to the Ministry of Education here in Quebec, so I can tell you what's happening here. But I wouldn't be able to speak for all other provinces. But there are initiatives to really, we have allocated significant budget that school boards can ask for to provide extra services to children most in need, but school boards need to ask for the money. So the money is there, they need to have a plan, they need to ask for it to the Ministry of Education, but the money is available and is targeted to children who have more difficulties than others. There's a number of plans that are being made at the moment, but it's not clear what will go ahead. But for sure, there is this plan to offer extra mentoring to children after school, and it's already started. So it's not fully deployed, but it's already started. And the idea is to try to complement the education they receive during the day with extra hours after school.
Thank you so much. So we are at the end of the session, but I do want to thank you, Dr. Haeck, on behalf of the CanCOVID team and network. We thank you for your time to present to us on this informative and timely talk to our research team and network. And I am looking forward to further research in this area by you and your team. So I'll look forward to that. I do want to make just one quick announcement before we end. Please join us next Tuesday, April 20th at 4 p.m. Eastern Daylight Time to hear from Dr. Kevin Potty, a clinician investigator at the University of Ottawa in the Department of Medicine, who will be presenting on homelessness and COVID-19. Thanks, everyone, and hope you have a great rest of your day.